This is FX Radio, and I'm Andrew Whitfield-Cook. And with me in the studio today is Amie Skilton, who's a naturopath, a nutritionist and herbalist of some 13 years' experience, who specialises in several areas of clinical practice, including weight management, gut restoration, food sensitivities, but also women hormonal imbalances and, importantly, skin disorders. And that's what we're here to talk about today. Welcome, Amie.
Thank you.
So, Amie, you've also got a role as senior educator with Bioceuticals, and you appear regularly on TV with a skincare range called Dijonesse, which you formulated. Mm-hmm. Tell me a little bit about why you did that. Where did this happen from your experience?
Well, like many other great inventions, they come from a personal requirement. And growing up as a teenager with hormonal imbalances of my own, I suffered from sebaceous cystic acne. Wow. And from there, a lot of scarring and issues with my skin. It's been a constant battle for me. I was never one of those girls who was lucky enough to have great skin. So... Wow. As a naturopathic student and then as a naturopath, I was able to deal with my hormones internally eventually, and obviously using other herbs to clear my skin, and also at that time was looking around for great skincare to use on my skin that was effective but didn't contain chemicals that as a naturopath I didn't want to use on my skin, and there really wasn't anything. So Dijonesse was really born out of being able to take care of the skin with a therapeutic grade product that was plant-derived but also petrochemical, silicon, paraben-free. And in addition to that, utilising specifically selected phytonutrients and vitamins and minerals to actually heal and nourish the skin from the inside. So it's an area that I'm really passionate about, because skin obviously is an excellent barometer of what's going on inside you, and I both love and hate that fact that when your skin's not looking great, it's telling you something. But I'm also, from personal experience, and obviously in that time treated many people for skin problems, understand the kind of impact that it has on self-esteem and confidence and who you get to be in the world. And so it's something that I'm...
Well, you certainly can't tell that from looking at your skin, because I know the listeners can't see you, but they should look at your work that you do on YouTube, and you can tell that you absolutely positively glow. So let's talk about this experience that you have and showcase some of the herbs which are steeped in naturopathic history, and they're the depurative or alterative herbs, otherwise known as the lymphatics. So lymphatics are in general. What are the range of conditions which you use them for? And where do you find them of greatest benefit?
So lymphatic herbs have applications to skin as well as a much broader application in terms of the lymphatic system and the immune system that's associated with that. So I guess skin things are really obvious. So whenever you have a chronic skin condition, whether it's eczema or psoriasis or acne or perhaps recurrent boils, for example, you definitely have to look at the lymphatic system as an area that needs extra support. But building on top of that, there are other signals from the body that the lymphatic system is congested or perhaps overwhelmed with pathogenic material or in need of further support. And that can show up as tonsillitis, sinusitis, any sort of swelling and infection in adenoids or tonsils or sinuses and that sort of thing. It's almost like, to use a car analogy, when an oil light comes on in your car, that's really what swollen tonsils are to us, or swollen adenoids or chronic sinus infections. And it's really, in a car obviously indicates the oil is low and therefore you need to put oil in. And though that sort of signal from our lymphatic tissue that we can see and the oral mucosa is really telling us there's issues with the rest of our lymphatic system, more often than not coming from the gastrointestinal system. And obviously that forms part of any sort of repair program. But certainly, chronic infections, tonsillitis, sinusitis, and gut stuff can indicate lymphatic issues.
That bunged up feeling.
Yeah, exactly. Just clogged up. The lymphatic system is one of our sewage systems, if you like. And if it is congested, you do have this overwhelm of toxicity and junk in your body, which can show up in any number of ways.
So the skin's arguably the easiest tissue to see issues with elimination because we look at everybody, all day long.
Yes.
You've obviously got a lot of expertise in this area. So what sort of things do you see women especially, I guess, presenting with? And when would it lead you to think of issues elsewhere in the body?
Well, when you're looking at traditional face mapping, that can give you your first clue as to where else you might need to investigate. For example, if we're talking about breakouts and acne and pimples, the forehead is indicative of the digestive system. If you've got breakouts around the jawline and the chin, that has to do with reproductive systems, hormonal imbalances, and obviously the most obvious indication being PCOS. That's quite commonly associated. There's other areas around, the temples, which are associated with blood sugar and insulin sensitivity issues. Cheeks and things are around the lungs, and also more specific for lymphatics. No matter where it shows up, you really do need to deal with the gut and the liver and the lymphatic system, but it does help to indicate perhaps specifically which organ system might be responsible for the overload or where it's really let the rest of the team down. So certainly acne, but eczema and psoriasis also are just another way of, a build-up of lymphatic material that isn't being dealt with will come out somewhere in the skin. If the other elimination organs can't deal with it, the skin ends up copping the leftovers, if you like. So when someone's presenting with eczema or psoriasis, for instance, you would also, of course, think to look at depurative and ulcerative and blood cleansing and lymphatic stimulating type herbs. So certainly you've also got to look at issues with polycystic. Obviously, that's almost another area where you're getting an accumulation and an overburdening of hormones, which is supporting the lymphatic system will also help them. Now, certainly if anyone presents with digestive issues, you're going to have to think about the impact on the lymphatic system, in particular as it relates to constipation. When you have retention of waste material in the gut and you have all those Peyer's patches that are, pulling up everything that's coming through into the lymphatic system, that's absolutely going to wreak havoc on your well-being and your energy levels and your ability to think clearly and sleep well and wake up feeling fresh. And in addition to that, skin issues can obviously arise. So you want to obviously consider digestive things as well.
I think the first thing that we've got to realise about the skin is that it's an excretory organ.
Correct.
It might not be the primary one, but it certainly is. And if it's not going to come out the first ones, it's going to come out your skin.
Absolutely. And look, we all have different propensities for our weak points. So, for me personally, my weak point is my skin. So if I'm run down or I'm stressed or I haven't been well, that's where it's going to show up for me. For some people, it might end up being their lungs, or it might be their kidneys or their liver or their gut. In some ways, I'm fortunate because in the hierarchy of importance of organs, your skin is perhaps one of the least important in terms of survival. Having said that, it's also the most obvious and public way of displaying that you're not very well, which is, I guess, the flip side of that.
So let's talk about with regards to therapy, because I think we always have to start at the beginning, at the simplest things. So tell me about what you use to help your patients start off on a journey of correct elimination.
Yes.
What do you use, and how do you find compliance with that, by the way?
You know what? When it comes to skin things, I know we're really talking about lymphatics as a whole here, but when it comes to skin, to be honest, there's nothing more motivating to someone than looking better. And I've got to say, when it comes to compliance, skin problems generally are pretty compliant because they have so much more personal interest in getting better because they're going to look better for it. So that's a really nice thing as a practitioner, not to have to be, dangling the carrot or whipping them with the stick, whichever works for your patient to get them to stick to the program. But you sort of have to take a step back and obviously assess everything for them. So, on a macro sort of view, you're going to be looking at lifestyle things like how much sleep they're getting, how much exercise they're getting, how much water they're drinking during the day. I mean, that's a really big one. Most people aren't getting anywhere near enough, or they're not drinking it correctly. Bowel elimination. I mean, if someone's not going every day, then there's real problem, but so many people are prone to constipation. They think every second or third day is normal because so many other people have the same sort of problem, along with those symptoms of bloating and all of that sort of thing. So you've got sort of that macro aspect to look at. And then as you start to drill down and look at it as a clinician, you can't ever dive into chronic conditions without repairing the gastrointestinal immune system. So you've got to look at the gastrointestinal permeability and what the integrity of the gut lining is like. And then once you've corrected that, you can then move on to the next organs of elimination, like the liver, like the kidneys, like the lungs and the lymphatic system, bearing in mind that it's an orchestra where you have to be supporting all of the instruments. So with the liver, for example, you've got to make sure that they're consuming enough fibre in order to be able to absorb the toxins as they are eliminated into the gut and therefore excreted from the body rather than being reabsorbed. So there's a lot of things like that to consider. So assuming you've sort of taken care of all of those foundational things, you've looked at, their environment, for example, and whether they're working with chemicals or they've got a mouldy home and those sorts of things, and you've looked at their diet and they're getting enough fresh fruit and vegetables and they're getting exercise and all of that sort of thing and rest, then you start to look at interventions that are specific to build on top of covering those bases. So you've got things like physical remedies, for example, lymphatic drainage. So you can go and see a lymphatic drainage practitioner specifically to do that. Also, I suppose I should point out, with the lymphatic system, it's a sewage system without a pump. And unlike our circulatory system that has the heart pushing everything around, the lymphatic system is really, the lymph is actually moved with the contraction and relaxation of the muscles. So light exercise is important for so many reasons, including oxygenation and glutathione production, but also to get that lymph moving. So lymphatic drainage is one. And you can, if someone's not particularly mobile or is particularly unwell, rebounding is one of those really old school traditional naturopathic things. And if anyone isn't unsure of what I'm talking about, those mini trampolines are called rebounders, and you just bounce up and down on that. And anyone can do that. If they have to sit on it and have someone bounce it for them, they can start there. There's also another traditional naturopathic intervention where you get, I think they're called lymphatic boards. I could be wrong on the terminology there, but a slant board, is the terminology, and it's basically a plank of wood, as longer than your height, and you actually just raise you chock one end up on a step, and you lie with your head down the lower end and your feet at the other end, and it allows your lymph to just slowly drain using gravity.
So just raising the foot of the bed type thing.
Totally. I mean, if you're really athletic, you can obviously use those inversion tables. If you're doing acrobatic yoga or inverted yoga poses, for example.
Bungee jumping not included in this therapy.
Well, you know what? Go for it. I won't go there, but you can. All of those things help to get the lymph moving back towards the circulation and clearing it out. Specifically looking at the face, if you're dealing with someone with acne, make sure they're not using water that's too hot, because that can actually inflame and aggravate the situation. So tepid water. A lot of people make the mistake of, they want to be clean, and so they'll have really hot showers and they'll scrub their face, and that's really actually counterproductive. So tepid water, being gentle, but actually teaching them how to do lymphatic drainage for their face. So, you can show them a diagram of how their lymph drains from the centre of the face down the neck, but essentially when they're perhaps rubbing in a moisturiser or serum, or even during the cleansing process, you want to ask them to use a rolling motion with their hands, pressing from the inside of the face out towards the ears, if you like, just to help drain that fluid.
Now, you've got videos on this on YouTube?
You know what? You could probably easily Google that. I'd be so prepared to make one for you.
Okay.
But certainly that is really helpful in moving that congestion out of the face and back into the systemic circulation where they need to. So I think that's really important because they're really practical, simple interventions. And I should point out at this point, I'm actually a qualified beauty therapist as well. So, that's where that comes from. But then you want to step down into herbs that specifically target and clean out the lymphatic system, and perhaps even as an extension of that are blood cleansing and antimicrobial, and there's all kinds of amazing herbs you can look at. I think one of the more popular ones is echinacea.
Mm-hmm.
Now, echinacea is well known and well loved for things like respiratory tract infections. And
Pigeonholed in that.
It can be, because it's really popular for cold and flus. I think sometimes practitioners forget about its, ulcerative properties in terms of skin cleansing and being antimicrobial, and the simple fact that it actually speeds up white blood cell activity applies to skin infections and lymphatic congestion as well. It will help clear that out. So I do particularly love that, and especially for any patients that you're seeing who in the past have responded well to antibiotic therapy for skin problems.
Responded well.
Yep. So that where it's coming from, that antimicrobial place, and improving the immune system's ability to deal with stagnant pathogenic material. I particularly love that one.
Mm-hmm.
You can certainly use quite high doses, especially if you're dealing with quite resistant sebaceous cystic acne or boils in particular as well. Very, very good for that. But then you can drill down into herbs that are more specific for lymphatics. So one of the gentler, really popular ones is cleavers or Gallium aperine, and that has a really beautiful, just cleansing property on the lymphatic system. In fact, a really nice daily habit that you can encourage your patients to do, if there's cleavers really readily available in your area, is actually putting that in a big jar of water and drinking from that, leaving it overnight to steep, and actually having infused water. That's a great way to obviously increase water intake, but having it as almost a medicinal water rather than just plain water.
Yeah, can be even eaten in a salad.
Oh, it's amazing in a salad.
If you can get the right herb.
Yes, and of course not being sprayed by pesticides and all of that. It's an amazing weed, so I wouldn't encourage them to be picking it from the roadside. Chances are it will be toxic. Now, cleavers itself is specifically for anything to do with the lymphatic system, whether it's inflamed or infected. So whether it's tonsillitis or adenoiditis or anything to do with the lymphatic tissue like that, and particularly if it's enlarged. So there may not be any pain associated with enlarged tonsils, for example, or adenoids, but there's a swelling there, which means that the lymphatic tissue is trying to capture and deal with something. So it's especially good for that. It's also BHP specific for psoriasis. So it has this incredible blood cleansing, skin cleansing property, which I think is really great. And it's used for the same reason for all kinds of chronic skin problems, including eczema and acne as well.
So helping with the hyperproliferation of the psoriatic plaques as well.
Yeah, it seems to have that effect. I'm not sure whether it's a direct one or a secondary one, but certainly a really, really powerful herb, particularly for psoriasis.
Right.
Yeah.
And so let's move on to some other herbs. I mean, see, one of the old ones that I actually used to use quite a lot when I was consulting, and that was poke root. And there was a lot of fear around poke root.
Yes.
And I remember asking an industry expert, who shall remain nameless, but I remember asking him about safe dosages of fluid extracts.
Yep.
And this gentleman basically said, look, you can easily double the dosage that's stated on the bottle without ill effect.
Sure.
The issue comes from Germans. Obviously, on the German hillsides, and poke root grows freely on these hillsides, and they used to pick it and put it into their salads when they went on a picnic and end up in hospital.
What a picnic.
Yep. Great day out.
Isn't that interesting? I mean, I know we've always been taught that it has a narrow therapeutic window, and perhaps relative to other herbs it certainly does. But in my experience, I too have nudged the upper limit quite safely. And I think it really depends on, again, your constitutional assessment of your client. You know, if they've had issues with the liver in the past, or are particularly toxic or have trouble eliminating, you might want to stick to the lower end of the dose. But if they're robust, generally well, no major issues, you could absolutely go higher than what most people would think is, acceptable, if you like. And poke root, I love poke root. It is such a brilliant herb, and it's really an excellent herb for treating pockets of infection. So whether it's a tooth abscess or a boil or a cystic acne thing, and it's amazing at just breaking that open and clearing it out. It's a very, very powerful herb, and I think one of my favourite lymphatics. I just absolutely adore it.
And it's even used for things like polycystic ovaries, isn't it?
Yes, in fact, that's, I guess, the other application. Again, it's that congestion in a really tight space, if you like, and just breaking that open and releasing what needs to be released, which I really love. So it's awesome for tonsillitis for that reason as well. I think we've touched on abscesses and things like boils. So yeah, it's a really excellent herb for any kind of lymphatic thing, but obviously has applications to skin things as well.
I liked two of the points that you raised there with regards to managing patients. And the first one is always look at your patient and assess your patient, each individually.
Yes.
Do not follow protocols. Look at patients. And the second one, I think, is one that I learnt long ago, and that is that when you're dosing, as long as you're not being toxic, as long as you're being safe with what you're using, that bad is not necessarily a bad result is not necessarily a bad thing. You just know how to manage it.
Sure.
You know to bring the dose down, or to even to change the therapy.
Yep.
Likewise, a great result, you will just pat yourself on the back and get a big head. But it's when you get nothing, no result. That's when you're dead in the water.
Sure.
You've really got to think about it.
Where to now?
Yeah, so with the use of things like poke root, even if somebody had a mild sort of tummy upset with it, as long as you're not being toxic with it, and I don't think you can with the, you'd have to be really silly with the dosages that are in preformed tablets and things these days. You'd have to be taking like huge doses.
A lot, yeah.
Then you just adjust the dose accordingly to the patient's response.
Yeah, absolutely. And, if they're a sensitive person, or if you're unsure of how they're going to tolerate it, just start low and bring the dose up. And knowing what herbs you're using and their mechanism of action will allow you to identify what might be going on. So, is it because there are anthraquinones in the product that it's upsetting the tummy and maybe creating a temporary looser stool or diarrhea? Or is it that it's an extremely bitter herb which is causing a flushing of the liver and maybe they're not eliminating regularly enough to get those toxins out? So you can always tweak things back and forth to get that comfortable middle ground where you're getting a result, but the patient's really comfortable. But my preference is to start low and build up because I like to help my patients feel better rather than worse. But as it happens to all of us, sometimes someone will have an exaggerated response to something and you end up having to dial it back or, work out exactly what's going on. There's nothing wrong with that. But certainly if you think about why you're doing what you're doing, chances are you should be able to avoid that situation.
Extremely well said. What about yellow dock? Because, it's one of these herbs that does contain smaller amounts of the anthraquinones.
Yes.
Doesn't really tend to be a purgative, but can still have that a little bit of a cathartic action, can't it?
Yeah, and that's, I guess, one of the many elements of its action, because in that sense it's almost an eliminative detoxifying agent. Of course, you've got to, again, assess your patient. Are they prone to irritable bowel, gastrointestinal upset? Have they had a history of a lot of antibiotics? Are they going to be sensitive to it? Again, I think it's one of those herbs that you might want to start slightly lower and build up. Or alternatively, what you could be doing is recommending carminative herbs with it. So, I'm thinking of one particular patient of mine who can be a little bit sensitive at times. For someone like her, I'd probably be prescribing, if I can call it that, 2 cups of like peppermint and chamomile tea a day.
Yep.
So that she's actually getting just some nice, gentle, carminative herbs in the tummy just to temper any potential for, griping, which is highly unlikely, but possible. Again, it's about knowing what you're doing and what herb you're using and your patient's, I guess, makeup, their holistic makeup, and whether you think they're going to have what kind of impact it's going to have on them. So
if they're a sort of nervous type, tense patient, then you wouldn't use the sennas and cascaras, that sort of, the rhubarbs. You wouldn't use those sort of,
more aggressive herbs,
aggressive purgatives.
Yep.
Rather, you'd use relaxing type herbs to help relax the bowels rather than push things out.
Yep.
And so dosages, I know there's a wide variation, but have you got any guidelines that you could give the listeners?
Again, I think it really comes down to the constitution of the person. And, if they are a robust, particularly toxic and bunged up person, you want to be at that high end. And in some cases for herbs, you can even go up to double the, what would be considered a therapeutic dose for a time. Again, I build them up to that.
Yep.
One of the things I like to say to my clients is once it's in the stomach, you can't get it back. not usually.
Not without work.
Not without a lot of work. So... yeah, in that respect, I would build them up slowly to check the tolerance. But, like you said earlier with the poke root, people are quite nervous, I think, about using that. It's one of those herbs that in college we were warned about, this much is good and a little bit more is fatal. And it's not that black and white. No. I don't really want to say a gram here and 5 grams here of this. I really want you to sit back and look at your patient carefully and consider the therapeutic range, knowing you can nudge it over the top dose a little bit, but really, is the person going to tolerate that well? Are they going to withstand that well? Is their body going to respond? It's kind of like, with personal trainers, there's a lot of this these days where they're yelling at you and screaming at you, and I don't respond to that. And it's almost like, when you're using sort of robust levels of herbs, are they the kind of person who's going to respond to that?
Yep.
Or do you need to be more gentle and allow their body more time to facilitate that cleansing process? It's not a race. Do you know what I mean? At the end of the day, we want someone to feel good in the time that it takes them to feel that way.
I learnt that lesson the hard way with a lady that I was treating with anovulation. Who had anovulation. And in treating her quite robustly in my young and silly days, I brought on this massive case. I was doing some detox work and brought on this incredible case of pustular acne.
Wow.
And it wasn't top or bottom, it was all over her face. It was just horrendous.
Interesting.
Yeah, and she was quite comfortable to work through it.
That's good.
But I tell you, it was really quite confronting for her to walk in.
I bet.
And I tell you, it was one of the lessons learned about gently, son.
Yeah, and you know what? Again, I've done it plenty of times too, and you do learn these things along the way, and you get better at assessing people and where you think their tolerance might lie. Yeah. Having said that, you can get surprised. Yeah. I think you can think someone can tolerate it and you've checked all the boxes and they just don't. Yeah. But again, if that was to happen, depending obviously on what herbs you're using and what you're treating, but in the context of lymphatic and skin, I would just be dialing down to, say, quarter of the dose, or in some cases it might be appropriate to stop treatment temporarily and work on things like Epsom salt baths, dry skin brushing, lymphatic massage, lots of water. Yeah. I'd maybe switch to supportive agents like diuretic herbal teas to allow the elimination to come out from somewhere else. Mm-hmm. And I suppose in a way it's almost a sign that you've hit on the right trigger. You're heading in the right direction. You've just, absolutely. You've just gone a bit hard and fast. Oh, yeah.
So we've spoken about some herbs, but, there are many nutrients that are used in healing skin and things like that. Yes. And oils, indeed. So what about those? What do you use? I've
got so much I want to say, but just before I dive into that, do you mind if I talk about burdock for a minute?
Not at all.
Because burdock is one of those herbs. There's lots of liver herbs, right? And whenever you detox the liver and the gut, you're going to get better looking skin, better elimination. Yep. But burdock is one of those ones that I think when you're looking specifically at skin, you want to consider. Yes, it's a bitter herb. It's excellent for liver detoxification and as it relates to that, it will obviously help skin. But in addition to that, it has depurative and ulcerative properties as well as antibiotic properties and diuretic properties. So it's actually tackling the potential pathogenic microorganisms that might be in there, as well as supporting the liver and the kidneys and the cleansing of the blood. And as a result, it too is one of those herbs that's really popular for chronic skin stuff like eczema, psoriasis, acne, boils. So I'd want to include that in there too.
Yep.
But moving on to nutrients, certainly vitamin C is really important for collagen synthesis and wound healing and all of that sort of thing. So vitamin C support, I think, would be an integral part of any skin management program. And I would also recommend a vitamin C flush if someone's coming in to see you for the first time.
Okay,
So
yeah.
I actually recently wrote a blog post on that. Having said that, vitamin C flush is not a new thing. It's a kind of an old school naturopathic thing. Now, there's two kinds of vitamin C flush, actually, I should really point out. There's the vitamin C flush that is designed to induce a loss of bowel tolerance for the purpose of having a laxative effect. That's not the one that I'm talking about. I'm talking about the one where you incrementally dose vitamin C to saturate the tissues. And, you know, for most people that might be a gram every hour over the course of a day, and most people will lose bowel tolerance somewhere between 12 to 15 grams. If someone is really depleted or unwell or has been chronically sick, or their skin is just absolutely a mess, or their lymphatic congestion is out of control in terms of swollen glands and lowered immunity, then I'd consider maybe doing 2-gram increments. But essentially, you will reach a point of bowel tolerance and then you step down the dose day after day, 1 gram at a time after that in divided doses. So I won't go into that in detail, but it's worth looking at if you're dealing with skin things. Moving on from that, however, zinc and vitamin A, I think, are really critical elements for so many reasons.
Absolutely.
First of all, the pair of them are absolutely specific for gastrointestinal integrity. So when it comes to our number one elimination organ, where all of our immune system sits, or most of it, in the gut, it's absolutely critical for that. But looking at the two things individually, zinc to our white blood cells is like petrol to our cars. It's literally the fuel that they run on in order to be able to move around in our tissues, to be able to survey and actually deal with any pathogens, in particular our macrophages. So they're important for wound healing, but also clearing out any subclinical or latent pathogenic infection, which I think is really a critical part of that. It's also really important to release vitamin A from the liver. So using those two things in conjunction are absolutely critical. If someone is insufficient in zinc or low in zinc, using vitamin A on its own will eventually at some point cause liver toxicity problems. So giving those two together is my preference to cover both of those bases. Now, in addition to that, vitamin A is actually required in a number of ways that apply to both lymphatic health and also skin health. So looking specifically at the lymphatic stuff, it's actually required for lymphopoiesis, or the manufacture of a number of our different white blood cells, including natural killer cells and macrophages. So the ability of our immune system to actually tackle any residual infection or cellular debris from being unwell will require adequate amounts of vitamin A. It's also required for antibody production and also potentiates antibody response. So again, it supports our immune system in that way to deal with any infection that might be hanging around or any latent cellular debris in our lymphatic system as well. So just clearing up, helps the garbage men do their job, if I can put it like that, which I think is really important. Now, looking specifically at the skin, vitamin A also helps to maintain the health of epithelial tissue. Now, that applies to mucous membranes as well. But when it comes to skin and keratinization, it's important for cell turnover. So when you have an insufficiency of vitamin A, you get poor cell turnover, which can mean congested skin, buildup of dead skin cells on the skin, which means poor blockages. And, that just is an fantastic playground for microorganisms to breed and cause problems. So that is particularly important for acne, but also so to eczema and avoiding secondary infections when that hydrolipid film has been broken down.
Key.
Absolutely key. And of course, the cellular proliferation in psoriasis helps to be tempered somewhat by vitamin A administration. So that's really important. In addition to that, vitamin A will also downregulate excess sebum production, which is related to excess androgens. So teenagers of all sorts, that's why Roaccutane works so well. But it is that being a synthetic form of vitamin A comes with a whole host of other issues, whereas when you're using natural vitamin A, you get to avoid most of those.
Yeah, and I should actually point out that I once looked up, and I can't find this now, but I once looked up on the TGA website the toxicity of vitamin A with regards to teratogenicity.
Yes.
And there was one case report, and it turned out that it wasn't vitamin A at all. It was freeze-dried liver extract.
Wow.
Yeah.
Okay.
So in Australia, I've never found a reported natural vitamin A
Yes.
teratogenic effect.
Interesting.
I probably would assume there are those.
Sure.
But I think we've been so paranoid about vitamin A that unfortunately nobody will touch it. Not saying to go out and go mental on vitamin A, but I do believe that vitamin A is going to make a resurgence with, as you said, immune regulation.
Absolutely.
What's happening with interleukin 17 and
absolutely.
segmented filamentous bacteria.
I'm absolutely behind that. You know, so many people are terrified of using it in pregnancy, so much so that there have been babies born here in Australia who were blind as a result of the mothers being deficient in vitamin A. And even without removing that pregnancy element, people are really cautious about it and think, oh, toxicity, liver, and are playing in the 1 to 2 to 3,000 IU realm. And for me, you know, when you're looking at acne and androgens and that sort of thing, I'd be using 5,000 at least. I generally use somewhere between 6,000 to 8,000, sometimes a bit higher. Now, the potential for teratogenicity would be, you know, around sort of 8,000 to 10,000 IUs. It's probably even far higher than that. But when it comes to pregnancy, I don't go above sort of 7,000. And I would be more comfortable between 2.5 and 5. But so many people are like, oh, I'm not going to touch it at all.
There was the IVAG, it was the International Vitamin A Working Group set up by the World Health Organization, looked at toxicity in pregnancy.
Yep.
And I think it's on the second page at the bottom right-hand corner, that it states that pregnant women, regardless of their vitamin A status, so even if they're replete in vitamin A, can take an extra 10,000 IU at any stage of pregnancy and still remain safe. Now, I'm not saying that we should necessarily do that. We've got to be restricted by the laws of the TGA. I get that, because they're erring on the side of safety. And I think it's probably worthwhile to point out that not all of these herbs are appropriate for a pregnant lady.
Of course.
I would be quite cautious. So I'm just stating about the actual research with vitamin A is above that 10,000 IU somewhere. We don't know where. Exactly.
Yeah. And I mean, you've looked at I've looked at other research that has shown, you know, 50 to 100,000 IUs, you know, and without too much problem until you're hitting that upper limit, obviously for much shorter periods of time. So there is that spectrum which is unknown, but at least we now know the safe area to play in is much higher than we ever thought that it was. And obviously as clinicians also, we're going to look at what other supplements they're taking and elemental vitamin A content and looking at their diet and see how much they're getting through diet. And of course, there are also natural requirement for vitamin A. Everyone's, you know, the RDA and ODI are quite limiting, you know, in terms of personal requirement, and that can change on a daily basis or depending on what their immune system is dealing with. So certainly it's something I would encourage clinicians to use, especially when people are suffering from oily skin and cystic acne and that sort of thing, just to encourage cell turnover and slow down sebum production. The other thing to consider with overactive sebaceous activity is essential fatty acids, because often with the balance of essential fatty acids in the actual sebum tends to be out. And when you start to shift that back in the right direction, sebum production can slow down. So omega-3 is certainly very important, but omega-7 seems to be one of the key features when it comes to cellular health of the skin. It literally is the essential fatty acid our skin uses to moisturize itself, to repair that hydrolipid film, which we're all supposed to have. Now, that hydrolipid film is one of the barriers that our skin produces to really ward off environmental contaminants and really protect our skin from anything that's going to be touching it, airborne or otherwise. And very often with people with essential fatty acid depleted diets, or they might have secondary complications like fat malabsorption, for instance, and then their skin starts to suffer. And it's the first place often that it will show up. So dry, itchy, flaky, scaly skin is an absolute sign of an insufficient essential fatty acid delivery. Now, whether that's the diet is low, highly likely, digestive system poor, also probable. You've got lots of things to look at there, but omega-7 is absolutely specific. In fact, has research associated with it, not only restoring hydrolipid film, but for the treatment of atopic dermatitis as well. So that would be my first port of call. And the genius thing about that essential fatty acid is it is specific for epithelial tissue. Excellent for mucous membranes too, by the way, even though we're not on that subject. So things like dry eye and genitourinary dryness. But looking specifically at the skin, unlike when you're administering omega-3, when you're using omega-3 essential fatty acids for things like eczema, you're often having to use doses of 6 grams, sometimes 10, 12 I've seen used, and that could take several months before all the other tissues are replete with what it needs before the skin will get some. By all means, actually prescribe omega-3 because that's clinically indicated, but you can use a much lower dose and give a low dose of omega-7 and see an almost immediate result. I've seen so many incredible case studies on omega-7 in terms of wound healing and changing the nature of the skin. One client springs to mind, which I'd love to just share with you while we're on the subject. She came to me and she didn't have any particular skin problems like eczema, although her daughter did. But she had very, very dry skin. She had to moisturise twice a day. Wintertime, she'd take off her stockings and she said it was like it was snowflakes peeling off her legs. Her skin was that dry. Lovely. Really charming. And she said, will this omega-7 help? This seems to run in my family. My dad has it, my daughter has it, my brother has it. And, typically things that run in families are actually eating habits and nutritional deficiencies and the like. So I wasn't too sure how quickly she'd see a result or how effective it would be. It was actually a casual chat, not a formal consultation. So I didn't investigate any other mitigating factors that could be contributing to her issue. 7 days later, she said, I feel like I've been given a skin transplant.
Wow.
I have the most luscious, dewy, Mediterranean-like skin. And she's like, I've spent my whole life suffering with dry, itchy, flaky, unsightly, uncomfortable skin. And in a single week, this has changed my life. So a single nutrient like that can have a really profound effect. And I've also seen it help reduce sebum production in teenagers by just applying the correct essential fatty acid balance internally. The quality of the sebum that is produced becomes better. So microbial activity reduces. And in fact, on that note, I also want to point out there's this real catch-22 with acne sufferers and those with oily skin. And I've been through it myself. As a teenager, under the influence of too much free testosterone, I had PCOS myself. You just want to get the grease off your face and out of your hair. So you're shampooing your hair every day and you're using the cleansers that squeaky clean your skin, and that is the worst thing you can do because the more you strip the oil, the more your body works to put it back. And in fact, you should be applying oil, and it sounds really counterintuitive. And in fact, I'm sure almost all of your clients would look at you in horror at the suggestion, but I promise you it really works. And I'd be using...
Just got to be the right kinds of oil.
The right kind of oil. And, each person's individual preference might vary a little. Typically, jojoba oil and rosehip tend to be the most effective. I'd certainly look at using sea buckthorn, which is a major source of omega-7. I'd also consider dropping in antimicrobial and anti-inflammatory essential oils like manuka, so New Zealand native tea tree, lavender essential oil, so officinalis, and I'd maybe use something like... blue chamomile, for instance.
This is topical treatment.
Topical treatment, to reduce the inflammation and the redness. And if it was, say, something like eczema, blue chamomile is particularly soothing for that red, raw kind of eczema.
Do you put those oils in a base?
So with the essential oils, yes, you'd put them in a base of jojoba oil or rosehip oil or sea buckthorn oil, and you'd probably look at using a ratio of no more than 1 to 2 drops per 5 mils. So I'd keep it quite mild to begin with because, you don't want to tip them over into having it be an irritant, but what you're doing is providing antimicrobial, anti-inflammatory properties to the base oil that they're using. And my recommendation would be to do this in the evening because you can't put makeup on over oil and you probably don't want to walk around feeling greasy, but give yourself or encourage your clients to give themselves a lymphatic drainage and facial massage to get the circulation going and get the lymph moving and allow the oil to absorb in, and then just tissue off any excess so that they feel comfortable without having to wash the oil off their face.
Any other little hints and tips that you can give us about how to treat certain conundrums with skin conditions?
Yeah, I've got a couple of other things I wanted to share with you. I suppose one tip is a more general tip, but when it comes to skin stuff, whether it's psoriasis, eczema or acne, there's always a lot of inflammation, inflammatory cytokines being produced, and as a result, free radical oxygen species being produced and other free radicals. So whenever you're looking at something that's inflamed and angry, I would consider using high doses of antioxidants. So which ones you choose might vary on the condition and the patient, but certainly if there's a hormonal element, resveratrol is an incredible antioxidant. It's one of my all-time favourites. It appears to activate one of the 8 sirtuin genes that are responsible for cellular repair. So that actually appears to help the body use everything else you're doing even more effectively. It has a mild hormone balancing effect, as well as being an incredibly potent antioxidant. So that one is definitely a favourite. Alpha lipoic acid is also a really key one, which I love to use. And I'd also encourage your clients to introduce green tea as a daily ritual. It's a really nice way, again, to hydrate, flushing out the organs, but another source of antioxidants rather than plain water. And I think one other thing I would like to mention is using lactoferrin. Now, lactoferrin is a compound found naturally in bovine colostrum, and you could just use bovine colostrum or you could use lactoferrin on its own, but lactoferrin, when it comes into contact with stomach acid, is converted into the most incredible, powerful antimicrobial called lactoferricin, which is just a great blood cleanser. So it's particularly good for any kinds of infections, but especially acne and backne. So those breakouts that people get, on their body and their torso and the back and the chest and, that really sort of infected skin. It's incredible at just cleaning that out. So I'd also highly recommend that.
It's amazing, the expertise. And I've got to say to the listeners, we who know Amie, she walks in and she absolutely positively glows. So I do recommend that you look at the videos that Amie's got online
YouTube,
on skincare. So have a look at those. But Amie, thank you so much for taking us through some of the more important lymphatic herbs and nutrients and oils. And I look forward to our next talk.
Thank you. You're welcome.
This is FX Radio, and I'm Andrew Whitfield-Cook.